Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to another episode of your guide to dental health with Diaz. Today I am talking about crowns and why do some of you need crowns. So a crown, the concept of a crown is basically a cap that goes over your tooth to seal the tooth, just like a cap over the water bottle basically. And the indication for a cap could be a couple of things. One of them is right after a root canal, a cap is required since the tooth after a root canal loses its vitality and its blood supply and becomes very prone to fracture and cracking, and you can lose a tooth. The other reason for a cap, if the tooth has been compromised or damaged with extreme or severe decay, that the filling will not be able to support the tooth because the damage is beyond just a filling. So that would need a cap. Another reason is if you're replacing a cap with another cap, if the seal has broken or you had some kind of a leakage, the decay came back and the margin of the old crowns is deteriorating or breaking down, then you're gonna need a new cap. So those are the indication for caps. As far as when and how soon, it really depends on what your dentist see after evaluating the x-rays and after evaluating the condition of the tooth. For example, if you are, if the crown is indicative for a tooth that's severely decayed, there's nothing that you can do or the dentist can do to stop the decay completely from damaging the nerve itself. So you need to go after the decay, evaluate the damage and say, okay, there's really not much of tooth to support a filling. We need to do a cap. The crown process is very, very easy. Actually, it's a lot, more conservative than a filling, because you're just shaving around the tooth. You're not coring out the tooth unless you are cleaning a lot of decay. Replacing a crown with a crown, again, it's conservative. You just cut the crown off and you take another impression or a scan and you order a new crown. A crown after a root canal, the tooth is already cleaned out and cored out. We just pour a foundation and then we reshape the tooth to actually have, to fit a crown. It takes about 2 weeks, the process, from the time that you leave the office with a temporary. You're gonna wear a temporary, you gotta take care of it. You cannot bite something hard on temporary. You cannot do sticky stuff. You pull the temporary off. If you bite on something super hard that the tooth underneath the temporary won't be able to withstand, you can actually break or crack the tooth underneath it. And then that will cause even more problems or more treatment that will be needed to, correct that damage. So just be careful with the temporary. I don't like when the patient are very aggressively flossing around the temporary, because they always have the a risk of actually, taking or pulling the temporary off. So I tell them not to floss. Nothing is gonna go, in between the temporary and your other teeth, because I make sure that my temporary are nice and sealed and tight. Brush them really, really gently. Be careful with it. It's like a cast on your foot. You just have to, it's temporary for 2 weeks. Take care of it so the tooth underneath it will not have any surprises when we take the temporary off and put the permanent on. In 2 weeks you come back and it's about like 15 minutes. You pop that temporary cap off and we just seat the permanent one on with a permanent glue. And then we'll give you instructions for the first like 24, 48 hours how to take care of it until the glue dries underneath the permanent crown. So that's basically the indication of crowns of the whole process. So if you guys have any questions, please reach out to us. And we love you. Be safe. And I'll catch you with the next video.